Up next, we'll take up House Bill 283, Senate Bill 119, an act relative to a loan repayment program for human service workers. We're going to start with in person, and we have Bill Yelenak from the Providers Council. I did just receive word that many folks, probably myself included, are speaking a little bit too fast for the interpreters to clearly catch everything that's said. So I'm going to ask everyone to speak a little bit slower when you come up to testify, and I will as well. Thank you.
Good afternoon, Chair Kennedy, Chair Livingstone, and Joint Committee members. Thanks for the opportunity to provide testimony on House 283 and Senate 119. My name is Bill Yelenak, and I'm the President and CEO of the Providers Council, the state's largest human services membership association. I'm here today because this legislation addresses a critical issue that affects the stability of the human services sector across the Commonwealth, the crushing burden of student loan debt on a workforce that provides essential care to hundreds of thousands of our state's residents. We filed this bill in prior sessions, and we appreciate this committee giving it a favorable report before, though it hasn't gotten all the way through the process. We did, however, see some student loan repayment funding distributed last year. In 2021, the state first allocated $16.5 million in American Rescue Plan Act funds specifically for this workforce. It formed a student loan repayment board to come up with guidelines for administering that. That group finished its work in 2022, and the state opened applications for the funding in early 2024. We saw an overwhelming response. More than 3,100 human service workers applied for student loan repayment program, and the application portal needed to close early due to incredible demand. While only $16.5 million was available, workers requested nearly $63 million in funding. The need for student loan repayment in the community-based human service sector is there, and we're incredibly appreciative to the Commonwealth for its investment in this essential workforce. Yet just 721 applicants, about 30% of those who applied, were able to receive support. It's important to note our sector has more than 160,000 jobs across Massachusetts. We work in partnership with the Commonwealth on purchase of service contracts to provide essential services for individuals with disabilities, those dealing with substance misuse, our elderly and our veterans, women and children in need of support, individuals and families experiencing homelessness, and so many more. The state benchmark for human services direct care staff median wage is just $20.79 an hour, while the MIT Living Wage Calculator, by comparison, estimates a single adult in Massachusetts needs nearly $29 an hour to meet their basic needs. This gap makes it difficult in a field where nationally 70% of workers have student loan debt. Our legislation would allow workers employed at least 35 hours a week for 12 consecutive months the ability to apply for loan repayment assistance. Awards would be based on educational attainment and for between $6,000 and $30,000. Later today, you're going to hear from two human service workers. Jawaan Kellam will talk about how student loan debt incurred through his education and how it's a hardship for him and his family. Elaina Schreckenberger previously spoke in favor of student loan repayment funding at a Caring Force rally in 2023, and last year she received some of those ARPA funds, and that had a major impact on her life. We appreciate this committee's favorable report of this legislation in the last session, as student loan debt continues to increase, and we now have specific data showing the incredible demand for loan repayment funding. We hope you'll give this bill a favorable report again and encourage your colleagues to support it as well. Thank you for the opportunity to testify, and I'm happy to answer any questions you may have.
Thank you so much. Any questions? No? But
Thank you.
Thank you for introducing the next panel as well. So welcome up Jawaan Kellam and Elaina Schreckenberger. Jawaan from the Home for Little Wanderers and Elaina from Action for Boston Community Development.
Good afternoon. My name is Elaina Schreckenberger. I am a Community Services Manager with Action for Boston Community Development at the Austin Brighton Neighborhood Opportunity Center. As a child, I was diagnosed with stage 4 cancer and given less than 50% chance of survival. My family was relatively new to the area we were living in, and upon hearing of my diagnosis, many families and community members came together to help my parents get through each day while I went through treatment. After going into remission and seeing my own parents give back to the same community that helped them, I became inspired to do the same. I relocated to the Boston area from Atlanta, Georgia in the summer of 2017 after completing my master's in both social work and public health. I wanted to find an organization to work with that would teach me how to engage with community members and meet their needs. I joined ABCD to make a difference in my community and support some of the most vulnerable people in the Commonwealth. At ABCD, human services workers help 100,000 low-income people in Boston and the Mystic Valley area. People of all ages participate in ABCD's programs such as housing and homeless prevention services, fuel assistance, adult basic education and job training, and early education and care. While this job can be very rewarding when we're able to assist clients, it's hard when I and my staff are not able to have our own needs met. The cost of living continues to increase, and we may often be eligible for our own programs because of how low our pay is in this sector. Many human services workers, like myself, have student loans to pay off, which adds on additional expenses, leading us to have little left for saving. I spoke in favor of student loan repayment at the Caring Force rally in 2023, and I had this debt that was an immense burden on myself. I was able to get $30,000 in student loan repayment funds through the Council's MA Repay program, though I know I was one of just more than 700 workers who received this funding. Many more of my colleagues applied but were unable to access funding because it ran out. While I still have $16,000 left, this made an immeasurable impact on my life and allowed me to remain in the human services sector doing what I loved. An act relative to loan repayment program for human services workers would help to significantly ease the burden of student loans for the human services workers who wish to continue their education but do not have the funding to complete this on their own. I hope that you will strongly consider supporting this bill, as it would allow us to continue to serve our clients and be able to afford living here. Thank you.
Good afternoon, Chair Kennedy. Good afternoon, Chair Livingston and the committee, for hearing my testimony. My name is Jawaan Kellam, and I'm a licensed clinical social worker at the Community Support Collaborative through the Home for Little Wanderers. I've spent a decade working alongside some of the most resilient families and some of the most resilient human service workers in Boston. I am also a husband and a father of 3 beautiful girls. And this is a daily reminder for me that what it means to fight for a better future. Every morning I rise with this purpose. This work is personal for me. I'm committed to not just healing my own household, but also healing my community as well. I don't believe in the power of human services, I live it. Right now, our communities are hurting, our Commonwealth is hurting, and across this country, the pain is real. From past traumas and present crisis, people ask, what's the answer? And I tell them human service workers are. Human service workers are the bridge between breakdown and breakthrough, but we're being asked to do life-changing work while being crushed under student loans, juggling 2 jobs, and barely scraping by. Personally, I carry $93,456.98 in student loan debt. That's what it costs for my bachelor's degree, master's, and clinical accreditations to serve others. But this number isn't just financial, it's emotional. It's a weight I carry into every session, every home visit, and every act of service, and I know that I'm not alone. We are therapists, case managers, counselors, direct care workers, holding families together in some of the toughest times. And yet, we as workers are falling apart financially as well. Inflation is up, rent is up, childcare, groceries, and gas is up. Burnout in this field isn't emotional, it's economic. I've watched incredible colleagues walk away, not because they didn't care, but because they couldn't afford to stay. That's why I'm standing here for H283 and S119. This bill isn't a favor, it's fuel for this workforce to keep going. It says we see you, we value you, and your work matters. But if we lose our workforce, we will lose our impact. As a Black male therapist, I know what it means to be the only one in the room. I know what it means to be the young kid that finally sees someone that looks like them and feels safe to talk. Representation changes lives, but without support, without representation, it can't survive. So to our legislators, this is more than a policy, it's a statement of value. Invest in us, not just as workers, but as people. We don't need applause, we need action. Thank you, and I hope that we can pass H283 and S119. Thank you.
Thank you. Thank you for the work you both do. Any questions from the committee?
Thank you.
Thank you again.
Thank you.